All right, let's dive in. We're going deep with Dr. Hovey Bigelson. Now, he might seem like, your typical alternative medicine guy at first glance, but there's more to him. We're going to be looking at his book, See the Messages Within You, to kind of get a sense of what he's all about.
Yeah, and what's really interesting is that Dr. Bigelson, he isn't just some fringe doctor pushing, unproven stuff. He's actually a doctor of osteopathy.
Oh, so he's a real deal, like fully licensed physician.
Absolutely. He's gone through the same rigorous training as any MD you'd see in a regular hospital.
Okay, so when I hear doctor of osteopathy, I kind of think something totally different from like conventional medicine.
Right. I can see that, but it's not entirely true.
So break it down for us. What is it?
So DAWs, as they're called, they get pretty much the same training as MDs, same basic sciences, same tough clinical rotations, and they're fully licensed to prescribe medications and even do surgeries.
Okay, so what's the difference then? Why would someone choose the DO route over the MD?
Well, the main difference is really in their philosophy.
Hmm.
DOS, they have this big emphasis on how everything in the body is connected. They see the musculoskeletal system, your bones, muscles, all that, as a key part of overall health.
Okay, so like if something's off in your back, it could end up affecting your like digestion or something.
Exactly. The idea is that if something's messed up in your musculoskeletal system, it can have ripple effects and cause all sorts of problems throughout your body.
And that whole ripple effect thing, that's something Dr. Bigelson talks a lot about in his book, doesn't he?
Oh, absolutely. He uses this really compelling case study. A guy named Johnny, an Iraq war vet who was dealing with chronic dizziness and nausea for years after having multiple surgeries on his shoulder.
Wow, so like even after the surgeries, he was still messed up.
Yep. And it's a great example of how conventional medicine, with its focus on treating symptoms, can sometimes miss the root cause. The doctors kept treating his dizziness and nausea as separate issues, but Dr. Bigelson, coming from that DO background, he looked at the bigger picture. He considered how that dislocated shoulder could have thrown off Johnny's whole body alignment.
Hold on, so a messed up shoulder can wreck up your whole system?
It might not always be super obvious, but think of it like this. Your body works as one big interconnected unit, right? When one part gets out of whack, it can pull on other parts and throw everything off.
Yeah, okay, I'm starting to see the connection.
So muscles and tissues start getting strained in weird ways, leading to chronic tension and basically making your body function poorly over time.
So even though Johnny's shoulder was, like surgically repaired, his body was still out of whack.
Exactly. His body had to adapt to that injury, and it's not going to just magically fix itself. The surgeries fix the obvious damage, but the deeper issue, the disruption to his body's natural flow and alignment that remained.
Man, that makes you think, how many people are out there just like Johnny, stuck in this cycle of symptoms and treatments that never actually get to the bottom of the problem?
And that's exactly why Dr. Bittleson's point of view is so important. He's urging us to really question the assumptions of modern medicine, how we approach health and healing. He's basically saying, hey, there might be more going on here than we realize.
And it's not like he's saying something totally crazy and out there, right? I mean, there are tons of examples from medical history where what they thought was the best practice turned out to be, pretty bad. I remember that whole thing with thalidomide.
Oh yeah, that's a huge reminder that what we know about medicine is constantly changing. The Thalidomide, they thought it was this miracle drug for morning sickness. Then bam, all these babies are born with terrible birth defects.
It's pretty scary when you think about it. Like, what are we doing now that in 50 years people will be like, what were they thinking?
It really highlights that we can't treat medical knowledge as if it's set in stone.
For sure. Like, remember when they used to spray DDT on kids?
Oh yeah, directly onto kids to get rid of lice and mosquitoes.
Straight up insecticide on their faces.
And it wasn't even that long ago.
Crazy. Or how about, like, performing surgeries on babies without giving them proper pain relief?
Yeah, like they used to think babies couldn't feel pain the same way adults do. Crazy, right?
It's mind-blowing. And this wasn't ancient history. This was happening in the 80s.
Exactly. It just goes to show how important it is to keep an open mind, to question things, and to always be looking for different perspectives.
Absolutely. And it sounds like Dr. Bigelson, he's all about questioning those assumptions.
Definitely. He challenges us to look past the diagnosis, which he sees as just a label, and really try to understand what's causing the illness in the first place.
He even says that the diagnosis itself is a symptom.
Yeah, it's pretty radical when you think about it.
It really makes you rethink the whole medical system.
Imagine you go to the doctor feeling tired, headaches, brain fog. You get diagnosed with chronic fatigue syndrome, but that diagnosis, it doesn't explain why you have those symptoms. It's just a name.
Like putting a label on a box without even looking inside to see what's actually in there.
Exactly. And this is where Dr. Bigelson's osteopathic training really comes into play. He wants to understand the whole person, their story, their life, everything that might be contributing to those symptoms.
Instead of just trying to mask the symptoms with pills.
Right. He might look at old injuries, how they stand and move, even their stress levels. All these things can mess with the body's natural flow and cause a domino effect.
You keep saying flow. What exactly do you mean by that?
Picture a river, just flowing naturally. Now imagine something blocking it, a fallen tree, a pile of debris, whatever. The water can't flow properly anymore. It might back up and cause pressure upstream, or it might have to change its course entirely. That's kind of like what happens in the body.
Okay, so you're saying the body is like a river with energy and information flowing through it.
Yeah, that's a good way to think about it. And just like that river, if there's a blockage or disruption in the body's flow, things start to get out of balance.
And that can show up as pain, inflammation, maybe even weird symptoms in a totally different part of the body.
Exactly. And this is where the whole messages idea comes in. Remember the title of his book, See the Messages Within You? He's saying those symptoms are the body's way of telling us something's wrong.
Instead of just shutting up those messages with drugs, we need to listen to them.
Exactly. He's a big believer in understanding those messages, not just silencing them. And one thing he focuses on a lot is scar tissue.
Scar tissue, like from an old injury or surgery.
Yeah. A lot of people think of scar tissue as just a cosmetic thing, but it can have a big impact. Every surgery, every injury, even a bad cut leaves behind scar tissue. And that tissue, it's not like normal tissue. It's stiffer, it doesn't have as much blood flow, and it can create these adhesions that basically bind tissues together.
Oh, so it's like those kinks in a hose.
Exactly. And those restrictions, even from old injuries, can affect how your whole body works.
So how does Dr. Bigelson try to fix those knots and get the body flowing smoothly again?
Well, a big part of it is osteopathic manipulation.
That's where they use their hands to adjust your bones and muscles, right?
Right. It's very digital, hands-on techniques to address imbalances in the musculoskeletal system. They're working to release those restrictions in the fascia. That's the connective tissue that surrounds your muscles and organs.
He also uses some homeopathic remedies, which I know can be a bit controversial for some people.
Yeah, homeopathy is a whole different system of medicine. It uses highly diluted substances to try to stimulate the body's own healing responses.
So it's not about suppressing symptoms, it's about encouraging the body to heal itself.
Exactly, and it's all about supporting the body's ability to find balance.
So he's using a few different approaches, working on both the structural and energetic levels of the body. And I'm guessing lifestyle plays a big role too, right?
Oh, absolutely. Dr. Bigelson really stresses the importance of nutrition, exercise, stress management, all those things that contribute to overall health and well-being. He sees them as essential parts of the healing process.
It's not just about passively receiving treatment, it's about actively participating in your own healing.
Exactly, and that's one of the things that's so empowering about Dr. Bigelson's approach. He believes that everyone has the power to heal, and that true healing happens when we work with our bodies, not against them.
This is all super interesting, but I bet some people are wondering, how does he actually figure out where those disruptions in flow are? What tools does he use besides his hands and his knowledge of osteopathy?
One of the most fascinating things about his practice is that he uses live blood analysis.
Live blood analysis. What's that?
It's pretty simple, actually. They take a drop of your blood and look at it under a really powerful microscope. This lets him see the blood cells in their natural state, which can reveal things that traditional blood tests miss.
So it's not just about checking your cholesterol and stuff like that.
No, it's about looking at the health and function of your blood cells. Dr. Bigelson can see the shape, size, and how the red blood cells are moving, how active the white blood cells are, and all sorts of other factors that can point to imbalances or disruptions in your body's internal environment.
Wow, it's like getting a window into the inner workings of your body. Is this live blood analysis something that most doctors use?
Well, that's where things get interesting. Some practitioners love live blood analysis and think it's really valuable, but it's not universally accepted in conventional medicine. Dr. Bigelson tells this funny story in his book about a leading hematologist who actually refused to even look through his microscope.
A blood specialist refusing to look at live blood, that's like a chef refusing to taste their own food. But I guess Dr. Bigelson isn't letting that kind of skepticism stop him.
Not at all. He sees it as more evidence that we need to be more open-minded about health and healing, that we need to recognize that the current medical model has its limitations and be willing to explore other perspectives.
So what's his solution? Is he saying everyone should ditch conventional medicine and go see osteopaths and homeopaths?
Not exactly. He advocates for a more integrated approach. He thinks conventional and alternative medicine should work together, using the strengths of each to create a more holistic model of care.
That makes sense, right? Acknowledging that there's no one-size-fits-all solution for health.
Right, but it does require a shift in thinking, both from doctors and patients.
It's about being willing to question things, to be open to new possibilities.
And realizing that the body has an incredible ability to heal itself if we give it the right conditions.
It sounds like Dr. Bigelson is calling for a return to the basics of medicine, listening to the patient, paying attention to the body's signals, and working with the body's natural ability to heal.
That's a great way to put it. He reminds us that the body is not just a bunch of parts to be fixed, but this complex, interconnected system that is always trying to find balance and harmony.
And that's something we can all learn from, for sure. And it's like, it makes you wonder, what are we doing now that people will look back on and be like, seriously?
Right. Like, it's crazy to think about how much things change. And it's not always like big dramatic things either. It can be subtle shifts in how we understand the body.
Absolutely. And that's what makes this whole conversation about Dr. Bigelson so interesting, right? He's really pushing us to think outside the box, to question what we think we know.
Definitely. And he's not just talking about like fringe ideas either. He's talking about going back to the core of what it means to heal.
Okay, so let's talk more about that. You mentioned how he sees diagnosis as just a label, but he actually goes a step further and says that diagnosis itself is a symptom. Can you unpack that a bit?
Sure. It's kind of like this. Think about going to the doctor and you feeling exhausted all the time, headaches, brain fog, the whole 9 yards, and they tell you you've got chronic fatigue syndrome. But that diagnosis, it doesn't actually explain why you're feeling that way.
Right, it's just a name for a bunch of symptoms.
Exactly. And that's where Dr. Bigelson's approach comes in. He wants to go deeper. He wants to understand the cause of those symptoms, not just slap a label on them.
So instead of just treating the fatigue, the headaches, the brain fog, he's looking for the root of the problem.
Exactly. And that might involve looking at all sorts of things. Past injuries, how you're moving, how you're holding your body, even your stress levels.
Because all of those things can impact that flow you were talking about earlier.
Exactly. They can create blockages and disruptions that prevent the body from functioning the way it should.
Okay, I'm getting it. So how does he actually go about like untangling those knots and getting the body flowing smoothly again?
Well, osteopathic manipulation is a big part of it. It's all about using gentle, hands-on techniques to release restrictions in the fascia, which is that connective tissue that surrounds our muscles and organs.
It's kind of like giving your body a tune-up.
Exactly. And he also uses homeopathic remedies, which, as we mentioned earlier, can be a bit controversial. But the idea behind homeopathy is that it stimulates the body's own healing abilities.
So it's not about suppressing symptoms, it's about encouraging the body to heal itself.
Right, and it's about working with the body, not against it.
So it sounds like he's taking a multi-pronged approach. And I imagine lifestyle plays a role too, right? Things like diet, exercise, stress management.
Absolutely. Dr. Bigelson is a big believer in the power of lifestyle changes to support healing. He sees them as essential, not just an afterthought.
It's about empowering people to take an active role in their own health.
Exactly. It's not about being a passive recipient of treatment. It's about being an active participant in your own healing journey.
So all of this sounds really intriguing, but I'm sure some people are wondering, how does he actually assess all of this? How does he figure out where those blockages and disruptions are?
Well, one of the things that makes Dr. Bigelson's practice really unique is that he uses live blood analysis.
Live blood analysis, what is that?
It's actually a pretty simple technique. They take a drop of your blood and look at it under a very powerful microscope. This allows them to observe the blood cells in their natural state, which can provide a lot of information that traditional blood tests miss.
So it's not just about looking at your red blood cell count and things like that.
No, it's about observing the quality of your blood, the vitality of the cells. They can see the shape and size of the red blood cells, how well they're moving, the activity of the white blood cells, all sorts of things.
Wow, it's like getting a glimpse into the inner workings of your body at a microscopic level. But is this something that most doctors use? Is it widely accepted?
That's a great question. And honestly, it's where things get a bit interesting. Live blood analysis is definitely not mainstream. Some practitioners swear by it, but it's not something you're going to find in most conventional medical settings. In fact, Dr. Bigelson tells a pretty funny story in his book about a top hematologist who absolutely refused to even look through his microscope.
A blood specialist refusing to look at live blood. That's pretty wild. But I guess Dr. Bigelson isn't letting that kind of resistance deter him.
Nope. Not at all. He sees it as more evidence that we need to be open to different ways of thinking about health and healing, that there's more to discover beyond the current medical paradigm.
It's about acknowledging that we don't have all the answers and being willing to explore new possibilities.
Exactly, and being willing to step outside of our comfort zones and consider different perspectives.
So what's the takeaway here? Is he saying we should all abandon conventional medicine and just go see osteopaths and homeopaths?
Not necessarily. It's not about choosing one over the other. He's actually advocating for a more integrated approach where conventional and alternative medicine can work together.
So it's about taking the best of both worlds and creating a more holistic approach to healthcare.
Exactly. It's about recognizing that there's no one-size-fits-all solution when it comes to health and healing.
And it's about empowering individuals to make informed choices about their own health.
Absolutely. It's about recognizing that we all have the power to heal, and that true healing comes from working with the body's natural wisdom, not against it.
It really makes you think about how we approach healthcare. We get so focused on all the tests and procedures and high-tech stuff.
It's easy to forget that the body has this amazing ability to heal itself.
And Dr. Bigelson really brings that point home, doesn't he? Like, he uses that analogy of getting a cut.
Oh, yeah, that's a good one.
You don't have to sit there and tell your body, okay, now grow new skin cells, now form a scab. It just does it.
Right, we just kind of clean it up, slap a Band-Aid on it, and let the body do its thing.
And he's saying that same principle applies to healing from bigger issues, too.
Exactly. The body wants to be in balance. It wants to heal. We just have to give it the right conditions.
So what are some of those conditions? Like, obviously, osteopathic manipulation is one of the things Dr. Bigelson uses.
Right, that's about addressing those structural imbalances, releasing those restrictions in the fascia. And then he also uses homeopathy, which, as we've talked about, is a very different way of thinking about healing.
It's about stimulating the body's own healing responses rather than just suppressing symptoms.
Exactly. And of course, there's the whole lifestyle piece too. Nutrition, exercise, stress management, all that good stuff.
Yeah, it's about creating an environment where your body can thrive, not just survive. But I imagine all of this can feel a bit overwhelming, especially for someone who's, used to the conventional medical model. Where do you even start?
Well, I think Dr. Bigelson would say start small. You don't have to overhaul your whole life overnight. Maybe start with some mindfulness practices to help manage stress.
Or try something like yoga or Tai Chi.
Exactly. Gentle movement, connect with your body. And then, of course, finding a good practitioner is key, someone who understands this whole body approach.
He recommends looking for an osteopath, a chiropractor, a skilled massage therapist, an acupuncturist, someone who really gets how the body works as a whole system.
Right. Someone who understands that structure and flow are so important. And don't be afraid to ask questions.
Yeah, interview potential practitioners. Make sure you feel comfortable with their approach. It's your health. You get to choose.
Absolutely. Be an advocate for yourself.
Well, this has been a fascinating deep dive into Dr. Bigelson's world.
Yeah, he really challenges us to rethink what we know about health and healing.
He reminds us that the body is incredibly wise and resilient, and that we have the power to heal if we just listen to the messages our bodies are sending us and create the right conditions for healing to occur.
It's about working with the body, not against it.
So as we wrap up, here's a final thought. What if, instead of just trying to fix what's broken, we focused on creating an environment where our bodies can truly thrive?
That's a powerful question, and I think it's one that each of us needs to answer for ourselves.
Thanks for joining us on this deep dive, and we'll see you next time.